Although the Ministry of Health yesterday claimed that the Uganda Blood Transfusion Services had started testing the blood in its storage, regional blood banks in Masaka and Jinja were by this afternoon fully stocked with untreated blood.
Some of the blood is tested and the other is waiting to be tested. And once we avail it in total amount, so will be given out to the hospitals. So far this is what we have.
Currently now, we have some units collected, but the challenge has been for the screening kits. Well, right now I'm talking, they have got some in the Kasero and they are screening our blood. I think by the end of the week we shall be having blood.
Civil society organizations blame government planners for the glitch. Alana Kembabazi, the program manager for Right for Health under the Initiative for Social and Economic Rights, says the money allocated to Uganda Blood Transfusion Services is not enough.
We have seen the government consistently underfund this vote. I remember last year when the budget framework paper came out, we as civil society went to Parliament to point out that they were trying to reduce the funding for this critical service by about 0.5%. And the lack of funding shows the government is just not committed. Your failure to adequately budget means that people are dying from something as essential as lacking blood.
In the current financial year, government allocated 12.8 billion shillings to Uganda Blood Transfusion Services, yet the organization had requested for 32.2 billion. This led to a delay in procuring reagents to treat the blood. Ministry of Finance has granted a supplementary budget of 10 billion shillings to Uganda Blood Transfusion Services. However, this is not the first time the institution charged with distributing blood is having shortages. The Parliamentary Committee on Health has blamed the current shortage on poor planning and is calling for an independent audit into the expenditure of the organization.
We want to audit the 300,000 units that Uganda Blood Transfusion Services is saying they are collecting, whether they actually do. We want to audit the cost of collecting one unit. We want to audit how much blood is wasted, because recently we went to Kawempe and we saw blood on the dustbin.
However, if the public are expecting an improvement in matters, there are already signs that the perennial shortage of blood will continue. In the National Budget Framework Paper for 2019-2020 financial year, Uganda Blood Transfusion Services has been allocated only 18.9 billion, which is far below the 32.2 billion the organization says it needs to operate efficiently. For the time being, the shortages persist. GILLIAN NANTUME, NTV.